Addison Ragan. I work for the Department of Veterans Affairs as the Clinical Resource Hub Pharmacy Program Manager. And you may ask, what is a clinical resource hub? Well, in the VA, a clinical resource hub is this enterprise-wide network of hubs and spokes where clinicians work in a hub and deliver healthcare through telehealth modalities. So I had a windy path to pharmacy school. I started my educational career at a junior college and then jumped around to several state schools in Alabama, but then finally ended up in pharmacy school at Auburn University Harrison School of Pharmacy. So this is interesting. I started out thinking that I wanted to be an engineer alongside my now husband. We were in engineering classes together, and I soon realized that he was the engineer and I was not. And I realized that I wanted to do something that was more human interactions. I needed that personal connection, that relationship component of whatever that I decided to do. So I was in the kind of discernment process trying to figure out how I could use all these science and math classes and partner that with that relationship piece that I was looking for. And so I just kind of happen chance landed on pharmacy. And I thought, well, maybe that would work. And I ended up spending a summer in my small town community pharmacy, shadowing the pharmacists there. And I thought, this is my calling. I really love this relationship and how the local pharmacist had this long-standing bond with patients, this connection, and how he was really making a difference. And I was like, this is what I want to do. This is why I want to apply to pharmacy school, and I think this will, fulfill my cup, so to speak. I think the favorite part of my job is getting to innovate in this pharmacy space. So my job involves establishing models of care that really leverage telehealth, also digital tools. And so it's very exciting to be able to work kind of on the forefront of that, to get to pilot small projects that may then be able to be replicated on a much larger scale. The other really wonderful part about my job is being able to work outside of the pharmacy profession with, multidisciplinary teams that include physicians, business executives, nurses, mid-level providers. So often they may not have a really great understanding of what pharmacy practice looks like. And so because I'm able to work closely alongside of them, they're able to then glean a little bit better into what exactly a clinical pharmacy practitioner may actually do. And so we're able to kind of advance practice by stepping outside the pharmacy lane into these interdisciplinary groups where we can really share what pharmacists are capable of doing. For someone who's interested in a career in pharmacy, I think it's really important to explore all the different opportunities that exist. I think sometimes young college students, and I have 3 daughters, they really have limited viewpoint of what a career might look like in a particular profession. So I think as much job shadowing as you can do, as much volunteering as you can do, talking to folks really can help shed light on all the different careers that you might could have in pharmacy, besides just what you would normally think of as either a hospital pharmacist or a community pharmacist. So if you're in pharmacy school, I would really encourage you to reach out and explore lots of different career opportunities. When you're looking at what rotations to do, don't limit yourself to what you think you might like. For instance, I kind of didn't actually choose a rotation at the Department of Veterans Affairs. It was just put on my schedule, but it turned out that it really was the most influential, probably career decision that happened, and it happened by happen chance. So don't limit yourself as a pharmacy student into thinking you know what you want to do. I would say explore, take risk when you're deciding, what rotations you may want to do. And if you graduated from pharmacy school, I would also have that same advice. Don't limit yourself in the types of experiences that you think that you would enjoy. And I always try to let what is it that's going to bring me the most happiness when I go to a job, not what's going to provide the most money or things like that, be the determining factor. Sometimes you have to take risks, take those leaps of faith into jobs that you think are exciting and innovative, that may otherwise you might have passed up based off of other factors. So a typical day for me looks different every day, and that's what's super exciting about my job. On any given day, I may meet with other pharmacy leaders in my program and provide some consultation or mentorship. We may talk about how to resolve barriers to getting care into a particular medical center through telehealth modalities. We may also talk about how to build the business case to add on a cardiology pharmacist to their telehealth team so that they can expand access for their patients. Other meetings and parts of my day are often exploring and working with different program offices and key stakeholders on how we can expand training opportunities for students and residents in the telehealth community and space. So that would be also writing policy guidance, talking about the regulations that we may need to address so that we can make sure that our future pharmacy workforce has the skills and capabilities to provide, care through these innovative care modalities like telehealth, et cetera. So that's kind of a typical day, but no day looks alike, and that's what I really like about my job.